Yeah, thanks for having me, Andrew, and Strength by Numbers, and yeah, thanks everyone for tonight. Yeah, it's a bit of a passion area for me, and it's something that I've worked on probably over the last 7 or 8 years. Yeah, it first started with my time working with the Defence Force, and I've seen a lot of lower limb injuries, and I just started to think about prevention and if we could start to sort of screen for injury, or even just what a functional lower limb assessment would look like of someone uninjured. So I'm going to more go through, I would say, like my clinical reasoning in the physio world, so my why behind the assessment, and hopefully that gives just a bit of a framework into how I've approached utilizing tech, but also utilizing physio skills, utilizing movement quality assessment as well. So some of the objectives are to recognize the importance of developing a needs analysis. Want to try and learn how to analyze lower limb biomechanical demands, and then want to try and learn how to develop and implement a systematic testing battery based on physical qualities as opposed to just individual random tests. So my goal of a lower limb assessment is to maximize, and probably most of ours is to maximize usable information of someone's lower limb function. So whether that's qualitative, so coordination strategy, movement strategy, or whether it's quantitative, so numbers, data, science. So I just want to gather information that I can use to inform my rehab direction. And then also to think about what are the asterisk signs that I'm trying to accumulate to reassess to know if my program or rehab program is improving their function for what they want to get back to. But I also need, as any assessment needs to be, it needs to be flexible and adaptable. So I need to be able to assess someone, for me, someone healthy coming in trying to prevent an injury, writing a strength or prevention program, or someone really unhealthy with a chronic lower limb issue. So I wanted to develop a framework where I could use the same system to assess a runner who's trying to train for an ultra marathon event, who's uninjured and wants a strength plan to prevent injury, but also someone with that ongoing, lower limb knee pain who hasn't run or hasn't played sport or hasn't barely walked downstairs for long periods of time. And that's two people who are at a very different functional level. But how can I utilize a system that looks at the same physical qualities to help just simplify things in my mind? So in doing that, I needed to understand what healthy function was. And doing the Masters of Strength and Conditioning helped me understand how to take my lens away from pain and injury, and how to understand healthy and function and performance. And so for me now, I feel like it's difficult to assess unhealthy function or injured function if we don't know how to first assess what healthy function looks like. So to me, I need to know what healthy looks like, what a functional lower limb looks like, functional, so that I can get someone who's unhealthy or injured back towards that healthy state. And so it just requires a different thinking systems model in my mind. So my old model was very reactive. It was pain focused. It was trying to get someone better today, short-term thinking within session change. So that assess, treat, assess immediately. It wasn't always based on an objective test. So it was often, does the patient feel better? So patient satisfaction, customer focused. For me in that model, there's not a lot of need for heaps of information from technology or from force plates. I couldn't really use a system like AXID in that model when the patient's expectation is to get better today. I don't really need a baseline assessment that's looking at between session change. So a proactive model, which I try and have moved towards, looks at function. So I need to understand function. I need to assess function. It's long-term thinking. The outcome measures are totally going to change. I'm going to have to start to think about movement quality, strength endurance, strength power, reactive strength if I'm trying to improve function. It's looking at between session change, so an assessment today that I'm trying to improve tomorrow or into the future. And the success is an improvement in function, not necessarily pain, excuse me, which to me is more evidence-based. If I'm actually measurably improving someone's function, then to me that is something that I can rely on as evidence that what I've done or what we've implemented, what they've done, has actually made lasting change. So in that, I need information. So I need lots of information to develop a lower limb profile of someone, understand the demands on their system of what they're trying to return to, and understand where they're at currently. And then I need to try and bridge that gap. So I need more information, better decisions should create better outcomes. And so there's a higher need for that technology force plate. And so what I'll talk through is just that developing my lower limb functional assessment. And it starts with a needs analysis. And a needs analysis is the process of identifying the requirements of the physical qualities needed for that athlete or that sport or that activity. Based on that, we can then develop that testing battery, which becomes my functional assessment. And I can use that to determine the weakness or the strengths and weaknesses of someone, which will guide my program. So basically, I'll talk through that step-by-step process and how I get towards what tests that I'll use. So it's not, this is a test, this is how I do it, this is how you should do it. It's here's some reasoning, here's a system, here's how to start to think in this way if you need that system or if you're finding you're getting stuck. And this is kind of the why behind it. So when we do a biomechanical needs analysis, the first step is to understand what the kinetic and kinematic requirements of the activity are. So for me, for the lower limb, the biggest activity has to be running. So if we're thinking of an active population, I'm always going to think of running, even if it's a soccer player or obviously there's some change of direction, but if it's a basketballer, if it's a footballer, netballer, like I'm always still thinking the lower limb demands are mainly still running, there's jumping and hopping and landing, changing direction. But I need to understand what are the kinetic and kinematic requirements of running to understand what tests to put that lower limb through. So what I'll do is talk through the biomechanical demands of running. So basically, should be of no surprise, but humans have 4 locomotive strategies. So we can walk, we can jog, we can run, we can sprint. And these movements aren't, it's just a continuum. So we're obviously just increasing our pace, but our lower limb qualities, our lower limb biomechanics change, and the biomechanical demands on our lower limb change as well. So it's pretty common sense to think that walking's lower in biomechanical demands than running or sprinting. We intuitively know that. So when we walk, the knee stays extended through mid-stance and it provides a flexible strut that the body vaults over. So the lower limb biomechanically works like an inverted pendulum and our center of mass reaches its highest point during mid-stance. So we actually hit down, we flex into the knee a little bit at loading response, we'll re-straighten that knee generally at mid-stance, and that center of mass reaches its highest point at mid-stance. It aligns the vertical ground reaction force with the hip and knee, which minimizes muscular work. So it's a very, very efficient system. When we run, the knee flexes at mid-stance or during that first half of stance, and the center of mass is at its lowest point during mid-stance. So we're actually hitting down and we'll drop our center of mass, we'll get a bit of vertical oscillation, and then we'll spring back out. So when we run from early to mid-stance, the lower limb's acting like a shock absorber. So we're absorbing load eccentrically. We'll hit mid-stance, which is where we reverse it. We dig ourselves out of the hole, we overcome gravity, and we start producing force concentrically. So shock absorption is associated with these characteristic movements. So from initial contact to mid-stance, we'll generally pronate, ankle dorsiflex, flex into the knee, absorb shock by internal hip internal rotation. The pelvis will posteriorly tilt, and we may pelvic drop a little bit, all in this ability to absorb shock eccentrically and load the tissues or tendons eccentrically to store elastic energy. As we produce force, we'll get these characteristic movements again. We'll start to supinate the subtalar joint for a high gear push-off, rigid lever of the foot. Plantar flex, we'll extend the knee, externally rotate the hip, anteriorly tilt the pelvis, and then hike out of there. So this brings me back to the spring mass model. So during running, we're braking, and then we're moving towards propulsion after that mid-stance. So for me, I'm already thinking about what sort of tests I'm thinking about for a runner. If I'm thinking we've got this braking phase, we've got this short ground contact time, we've got this propulsion, we're going to need some shock absorption, we're going to need some power back in this lower limb. What tests am I going to be using for that? So as that leg spring compresses, it stores elastic energy in the tendons, which is released for propulsion. And so this is not just running. This is also how the leg works like a leg spring during running, jumping, hopping, and changing direction. So if we're thinking back to that soccer player, the leg still is reacting in this or acting in this spring mass way. We still want to be assessing it in terms of someone's spring-like qualities. And again, what tests are we coming back to for that? So as speed increases from walking to sprinting, we become less pendulum-like. So we said the leg stays straight and more spring-like. So basically, with this increase in speed, gravitational loading increases. So walking, we might put 1 times body weight through that lower limb. Running, it might be 3 times body weight. So as soon as we introduce a flight phase, there's more acceleration. We're going to have to decelerate. We might take 3 times body weight on that single leg that we're trying to absorb. So I'm thinking, what tests emulate single leg landing 3 times body weight? How do I assess someone's ability to absorb shock for that first half of stance phase of running? Do they have the capacity to? Because if they don't, they're going to be utilizing a different strategy, which is potentially going to be loading structures that aren't necessarily functionally designed for that much load. As we move towards sprinting, we get a reduction in contact time. So walking, it might be about 0.6 of a second. We're in contact with the ground. We've got, more than half a second to apply force into the ground to generate propulsion for our step length. Sprinting, that might be 0.1. So we need to be thinking about what tests do we need for a sprinter that emulate 0.1 of a second ground contact time. How do we assess reactive strength for a sprinter when the lower limb demands are that high from a stretch shortening cycle point of view? So if I didn't understand sprinting, wouldn't really understand why I'm testing single leg reactive strength and very closely looking at ground contact time. So as I mentioned, ground contact time is huge, and we need to understand this to understand our reactive strength testing. So a amateur marathoner may spend 0.3 of a second in contact with the ground, and this is the time period they have to absorb force and then produce force. So our rate at which we can develop force, basically force being how hard we can push into the ground in this minute period of time, is termed power. So we need to be strong to push with force in this short time period, which is determine that rate of force development. So I'm thinking, all right, so we need to be able to absorb through the limb, we need to be off the ground quick, and we need to be able to apply force, which will determine our step or stride length in very short periods of time as we're moving through these different biomechanical demands. So lower extremity stiffness is then the ratio of the ground reaction force, so how much force is going through that lower limb in comparison to the compression of the leg at mid-stance. So at mid-stance, obviously gravity is trying to pull us down to the ground as our body weight is absorbing, and our ability to defy that, to resist compression, to resist that collapse is termed lower extremity stiffness. So at one end, we've got that compliant person who drops into the knee a lot, who spends a long time on the ground, and then we've got the stiff spring at the other end of the spectrum as well. So do we need to have a test for that to have a bit of an understanding of someone's lower extremity stiffness? if we're thinking about getting them back to those higher biomechanical demands. So if we think about kinematic demands, so the motions involved, and for running, it's more sagittal plane, frontal transverse. We need a bit of, hip internal rotation, external, but generally most people will have the required range. But we need to know, if we're thinking about, a functional test, what sort of range of motion test should we put in for a runner, or if we're thinking of that systematized approach. So during running at the ankle, we'll hit down in relatively neutral. By mid-stance, we've moved into dorsiflexion, so around about 20 degrees. And if someone doesn't have this range, then it's a constraint on their system, and they'll alter their movement strategy, potentially early heel lift. Maybe they'll steal some motion from the subtalar joint in the transverse plane. Potentially they'll utilize, several other different movement strategies to get around that constraint. But I want to understand the constraint. Why does that person move the way they do? Will that show up later if they don't have any ankle range of motion? What's their landing strategy if they can't go knee over toe? Does that give me insight into why their landing forces are so high? Because they don't have the ability to load into the knee, to load that calf eccentrically. So I'm just gathering information on the person in front of me, and putting it all together and seeing if it makes sense. And it's all just one piece of the puzzle. I'm not over-analyzing any particular test. So we know we need to move into plantar flexion for toe off. And this is going to be changed by speed. Obviously, the quicker we go, we're going to get more plantar flexion at toe off. And that might be around that 25 degrees. If we're thinking of the knee in the sagittal plane doesn't need a lot of range of motion in terms of our testing process. So most people are going to have, 50 degrees knee flexion, unless they have a really stiff knee post-surgery. We're going to need more knee flexion range through swing, but I'm not thinking that we're going to be focusing too much on knee range of motion tests necessarily. The kinematic demands at the hip. So we'll hit down in hip flexion again. This is changed by speed. We'll move towards relative hip extension. And then at toe off, we're going to be around that. Again, there's obviously huge variation, but we're going to be moving towards that 15 to 20 degrees of hip extension. So again, I'm thinking, what range of motion test do I need to assess someone's hip extension range? Really, really common, really easy, simple stuff, but just forming some of my reasoning process. When we think of kinetics, so we've kind of covered a little bit of the spring mass model, a bit of kinematics, and then down to kinetics. So that lower limb is subjected to both vertical and horizontal forces. So to me, again, I'm not like a full biomechanist, so kinetics is still a little bit hard for me to get my head around. So I like to simplify it. Horizontal forces, I know if we overstride, will increase horizontal braking forces, but to me, that's kind of the extent that I want or need to know about that. But I want to think a little bit about the vertical ground reaction force. So when we hit down, especially if we heel strike, we'll get a passive peak force initially. Then we'll get this maximum peak at mid-stance. And so on that lower limb with running, at mid-stance, we've got that change between absorbing and generation. That's when the forces on the lower limb are the highest, and it's around that 3 times body weight. So again, a lot of load to absorb, a lot of load to overcome. And I'm just then thinking, okay, what is this leg doing during running? How's this starting to put together my lower limb functional tests? So as I mentioned, when we apply that force into the ground, we've got a minute period of time. That time is the area under the curve where we're applying force above body weight is termed the impulse. So if we're applying force in a very, very short period of time, then we need to be powerful. We need that high rate of force development. I want to have a little bit of understanding of someone's single leg power. If we're rehabbing someone back to running, we need to be improving their single leg power so that someone can effectively apply force into the ground during a short stance time to effectively gain some flight time, to take a long enough stride without compensating. So flight phase of running is down to that ability to generate power in the right direction. So it can't just be straight up. It has to be horizontally directed as well during that short time in stance, and that's determined impulse. Again, a little bit too biomechanical for me. I just want to know what I need to know, that I probably need to assess someone's power. So muscular demands on the lower limb. So far we know that we're going to need some reactive strength, some reactive tests. We need some shock absorption. We need some landing tests. We need some rate of force development. We need some power tests. And we need to know how much demand is on those lower limb muscles. So during running, we'll get around 6.5 to 8 times body weight through soleus, so pretty high. It's got a massive physiological cross-sectional area. It's capable of producing huge amounts of force. Probably want to have some test of isometric strength of soleus. Glute medius, 3 to 4 times body weight going through that lower limb. It's stabilizing really hard. It's absorbing force for the first half of stance as it eccentrically controls that hip drop. And then it's going to pick us up out and hike out and produce force. So a lot of load going through that. I probably want an isometric strength test of glute med. Quads. So quads to me are more our brakes. So they've got that absorption role. Yes, they'll dig us out of the hole for propulsion in the second half of stance, but I think of them as shock absorbers and our brakes. But we're probably still going to want a concentric strength test of quads. But again, it's not always essential to me because I see them as an eccentric braking system most of the time. Hamstrings are going to increase their role as speed increases, as they decelerate the extending tibia. But I still want to have an understanding, especially if someone's got, hamstring tendinopathy or back from hamstring graft. So just understanding that starts to allow me to understand what muscles I might not or need to test as much, or I might want to have some good reasoning why I'm testing that specific muscle. But I just want to understand what are the demands on that muscle to understand what strength, isometric strength or strength endurance tests I'm going to implement. So if we summarize that, all I like to think about is if I'm assessing a function of someone's leg, what does the leg need to be able to do? So it just, to me, needs to be able to land, it needs to be able to absorb force and impact, it needs to be able to spring, it needs to be able to store and release elastic energy under loading after eccentric loading, and we need to be able to hop. So we need to be able to produce force to dig out of the hole for running or for hopping. So it's very simple. And if I don't have those 3 tests in my testing battery, then I'm not really covering full function of that lower limb. And I'm probably not really assessing someone's ability to run or to change direction or to jump or to hop or to land. So I'm thinking about that. And usually if someone struggles in one of those 3 things, all my rehab is directed towards improving that thing. And that is my asterisk sign for reassessment. If they can't single leg land, can't absorb eccentrically, okay, what are the components that go into single leg landing? Eccentric quad strength, maybe eccentric calf strength, if they've got some apprehension, even just that confidence. So that's usually the thing I'm rehabbing towards: landing, springing, or hopping. So the components that go into that, so to hop, we need a spring-like foot, Achilles and hamstring tendon that store and release elastic energy. We need eccentric quad strength to resist gravity's pull and work as brakes. We need concentric quad strength. So it probably is important to an extent to test concentric quads and plantar flexor strength and power to rise the center of mass. But that's a lot within the calves for propulsion. So it's just justifying why we're testing what we're testing and thinking a bit more deeply about it. Do we need to assess eccentric over concentric, or can we justify concentric only? We need some hip strength and power to apply a horizontal force to accelerate, more for sprinting, but a healthy lower limb has a hip that can hinge, has a glute max that can reach that position where it's in a good length tension position to produce a horizontal force to accelerate. We need some hip control to steer the femur. So to be able to get out of that shock absorption, hip internal rotation position and externally rotate for the second half of stance, we need some control of that, some ability to steer the lower limb and to control or rotate the pelvis if we're looking at a rotation sport. And then we need some core strength to control excessive trunk motion and provide a stable base of support to apply force into the ground or to move the extremities. So this is my healthy lower limb. And when I'm assessing someone, I'm thinking about those qualities plus landing, hopping, springing. So that was step one. So understanding the lower limb biomechanical demands. And so I would do this for any sport. So if it was soccer, it would only change a little bit. There'd just be, okay, soccer introduced a change of direction. And I'm not thinking physiological demands, obviously, but most sports are going to have quite similar lower limb. You're just going to tweak it a bit. And so your testing is just going to change a little bit. Maybe you'll have some adductor or adductor squeeze or potentially a reactive strength, maybe a lateral reactive strength, a lateral hop. So it's just understanding that rather than the injury or the pathology. It's what are the demands on that are going to be placed for a successful return to sport or return to activity or function on that tissue. So step two is based on those biomechanical demands, what physical qualities are required. So I already talked about that a bit, but we need to move well. So we need some movement quality to be able to run. We need some single leg stability. We need to know how to go from triple flexion to relative triple extension in almost like a squat pattern. We need some interlimb coordination. One flexes, one extends. We need those legs to be coordinated. We need some general springiness, some stiffness through that lower limb. In terms of range of motion, in the sagittal plane, we know that ankle needs some range, that hip needs to be able to extend. In terms of power, so power is another physical quality that we're going to try and improve. We need that single leg power to apply force within a rapid time period. We need the ability to absorb single leg shock absorption. Need some reactive strength for the stretch shortening cycle use for that springiness in the short ground contact time to improve our efficiency. We're going to need some strength around the ankle, the knee, and the hip. We know there's large loads, glute med, quad, soleus. Need some strength endurance for fatigability, especially around that ankle, around that knee, and maybe around that glute med and hip too. So step three, getting there. It's going to be what are the most representative physical tests to assess these physical qualities. So if we need some movement quality, I'm going to think, all right, let's do some movement assessment, movement quality. How do they run? What's their strategy? How do they walk? How do they squat? How do they single leg squat? How do they hop from an observation point of view, that qualitative analysis? In terms of range of motion, might throw in a knee to wall, ankle dorsiflexion, maybe a Thomas test. We'll often look at hip IR and ER as well, just to get an understanding of their rotational profile, if they're a runner, or if they're really toe in, toe out. I just want to know what their structure is. How does that influence their movement strategy? Is this changeable, or do we just need to strengthen and improve capacity of the biomechanics that they've got? Power, I'm going to choose the simplest one for me, a single leg hop for height. Shock absorption, simplest one for me, a single leg land off a 30 centimeter box. Reactive strength, single leg generally, if they can handle it. Again, this is all adapting depending on the individual. I think most people here are health practitioners. So if someone has pathology and pain, you're adapting this, obviously. Maybe you go double leg. Maybe you don't assess that yet, but you come back to it. So reactive strength, a drop hop or a rebound hop. Strength, so strength, the ability to apply force maximally. So how much force can someone apply? I'm going to assess an isometric test for that. So usually around soleus, hamstring 90-90, hip abduction, knee extension. And so you can plug and play, like I'll take some of these out depending on the person, depending on what I've seen from a movement assessment, if they can squat well, I'm taking out ankle doors. Like I don't need to know that. It's not impacting their function. So I'm trying to get a lot of information early to know what I don't need to assess. But at the end of the day, I'm basically looking for my asterisk sign for reassessment to know if my rehab program is improving them or not. And if it's not, if that metric, whether it's movement quality, whether it's power, whether it's strength, whether it's subjective function or functional outcome measure, subjective measure I've used, if that is not improving, my program's not working and it's useless. So my physical lower limb tests are around, as I said, qualities, not tests. So movement quality is nothing to do with accent. That's coordination and movement strategy. I want to see that first. Range of motion, pretty clear. Then I'm thinking power, landing, reactive strength. So land, spring, hop, isometric strength, maximum ability to apply force, strength, endurance, fatigue ability. What are their biomechanics like under fatigue? Do they fall apart? So movement quality, I won't go too much into how to analyze and observe movement quality. I'll just take you through my exact process. So I'll look at someone running in the sagittal plane and the frontal and transverse, and I'm always thinking, am I looking qualitatively? So just observing and understanding how they move, or am I gathering data and science? So I don't have a force plate, so I can't get force plate metrics, but I can get spatiotemporal metrics of running, so around sort of cadence, stride length, ground contact time, flight ratio, and whether that's, quite asymmetrical side to side or post injury. Obviously that's quantitative, that's not movement quality, but I won't go too much into that. I'll look at someone's squat, and I'm never over analyzing any one point. That's why I don't over analyze force traces, because it's just all a little bit of information. Single leg squat, but I'm just looking and understanding the mover in front of me. And basically this first movement quality assessment to me is also directing how much attention I will pay to, is also directing how much attention I'll pay to quantitative measures. So if someone doesn't move well and can't organize their body well in space to produce a squat, a single leg squat or hop, to me, I'm not looking much into rate of force development, reactive strength, because I'm dealing with a coordination movement strategy issue first. They need some motor learning. I need to teach them how to move better to even be able to express or produce the force, power, reactive strength that they've already got. So the metrics I get will not be as relevant to me. I need someone to be able to move okay, to be able to trust a little bit more in the tests that come later. So it's a quick screen of, obviously, you're going to get some range of motion insight. You're going to get movement strategy. You're going to get a little bit of hip control, and you're getting a little bit of general springiness. And you're also starting to understand what's the skill of the mover. Are they low skill? Okay, why even measure power? Like, it's just, implement anything and power will improve, but power didn't improve, coordination improved. So that's what I'm sort of thinking about initially for movement quality. So range of motion. So you can use the tablet as well for this to measure. I didn't actually get a photo of it. I was running late on that, but otherwise knee to wall. So again, running, change in direction, landing. Again, there's no association necessarily between lack of dorsiflexion and injury, but it's still a constraint on the system. It's going to change movement strategy. It's going to help us understand that person, understand the way they move, maybe understand their single leg landing, maybe understand why they've got an overloaded calf if they have an early heel lift because they can't get that shin forward. So it's just understanding that person. So in terms of range of motion, simple ones for me. ankle dorsiflexion, hip internal and external. I want to understand someone's, I call it rotational profile. I got this from pediatric physio, but if they're really rotated, is that coming from the hip or the tibia? And just having an understanding of the way that person moves and what structures that's going to load and the things that we can't change. So I think assessment of structure is really, really important, to know the things that are unchangeable and how it'll shape the loading strategy or the loads that someone puts on particular tissues, and to know when movement, motor learning or skill-based learning won't improve someone's movement quality. And then potentially Thomas tests as well. So just that understanding of their hip extension range and their constraints on that and how that might load different or certain structures or change movement strategy. Okay, so if we're still working through those qualities, so I've looked at, this is really, really quick, but I've looked at someone's potentially walking or running, squat, single leg squat, and then hop. And then I may have got a bit of insight. Okay, let's test knee to wall. Let's test hip extension. Oh, we don't need to. They move okay. So kind of like crossing things off. And so then I want to have a broad understanding of someone's lower limb function. And so I'm going to have an assessment of power. And to me, again, I keep it really simple. Single leg vertical hop, their ability to absorb shock through that lower limb, and their ability to spring out of there as well. Okay. So everyone's different, and I'd encourage everyone to pursue their own protocol, but I'll go hands-free. I don't go hands on the hips because to me, if you go hands on hips, you're going to alter someone's coordination strategy. And I don't think that necessarily is just isolating lower limb power. I think it's altering a movement strategy, and you're going to get a result. Like a single leg hop is a whole body movement. So it doesn't make sense to me. And as long as the assessor is consistent, then it shouldn't matter if you're collecting your own norms or as long as you're repeatable over time. But to me, it makes a lot more sense to go hands-free. But basically, the cues I'll give are hop as high as you can, as quick as you can. So again, what I'm looking at here is how quickly someone can load into that knee and not have to drop the center of mass too much before they can spring out. Can they get height? What's this from a qualitative point of view? What's the strategy? Do they stay again, I've kind of got rid of a little bit of the top half of the body here, but is there a large forward trunk lean and they're loading into the hip? Do they keep the trunk upright and load into the knee? So what's the general strategy? Are they more sinking down too far into that knee? How long does it take them to dig out of the hole? So if you think back to running, if we think we're absorbing load eccentrically, we're then loading that leg and then pushing up concentrically from there. So again, it's just a little bit of an insight. And some people may analyze this more than me. But I generally just look at, as long as their legs stay straight, so it's going to give me a consistent result. I'm just looking at their height side to side and compared to some norms and generally rate of force development. And so why a vertical hop? So a vertical hop is a very even distribution of propulsion from hip to knee to ankle. So around a third from each. And so if someone has an issue somewhere along the kinetic chain, it'll probably show up on a vertical hop. So to me, it's a broad look at someone's ability to apply force and achieve an outcome. So an outcome being height. Height isn't the be all and end all, but I still think it's a pretty good metric. I think there should be some consideration of rate of like how quickly they got there. You can get height while producing force slowly. But again, I'm not getting lost in the weeds. I'm just taking a little bit of info in terms of their ability, especially if I'm doing rehab, as long as they're getting some height and there's not a huge discrepancy like here, then I'm pretty happy. But again, this is my metric of power. So that's what I'm more trying to reiterate. I'm assessing not really a test. I'm just starting to understand someone's power for the demands to get back to running all their sport. So if I look at shock absorption, so if we took kind of technology out of it for a bit, generally I think that's 30 centimeter box is the best for me. But this test is probably my most useful test and my most used reassessment and direction for rehab. So basically, can they do it? And so often, again, more down that rehab path, but you get someone on a step and their brain knows that they don't trust that lower limb to absorb that 3 or 4 times body weight through it, so they won't do it. So even that's my reassessment. Okay, you're either not strong enough, apprehensive, fearful, or you're expecting pain, but that's still just my reassessment. I want to get you to the point where you can single leg land, whatever that takes rehab wise. But that's my asterisk sign for reassessment. And I know we are succeeding in rehab if they couldn't do that, and now they can, because the ramifications for function for that are huge for me. If you can single leg absorb 3 times body weight through one lower limb, and you couldn't previously, that's going to have a big improvement in function or quality of life for someone or return to activity. So firstly, if we took force plate away, it's just, and I'll actually start and hop down. Maybe it gets a little bit of height, but to me, if they step down, they just single leg squat it too much and almost just end up just like it's such a step. So I actually want to get a little bit, and I'll bear the brunt that it may not be. Some people may hop up a bit, and I'm fine with that. But firstly, can they do it? And sometimes I'll just go, okay, let's go off 30, maybe 40, maybe up towards 50, depending on the demands the person's getting back to. So maybe that sprinter, maybe that higher level has higher eccentric demands. We need to increase the acceleration of that falling center of mass to actually see how they go absorbing. Can they stick it? What's their movement strategy like? But my cues for that, I usually stick the landing, or try to stick the landing and try and absorb impact as much as possible, or land softly. So if we're thinking movement quality, I'll often look front on and then side on. So kind of thinking about that frontal and transverse plane. You know, what's their hip control? If they had a poor single leg squat, for example, is that amplified here? Or if they had a poor single leg squat, but their landing's fine, okay, I'm going to throw the single leg squat out. That didn't give me any usable info. Yep, stepping up. And then I'll sort of look side on as well. But in terms of movement strategy, I'm more looking around, where do they take load? So are they upright trunk? So if they're upright trunk, then the center of mass is more posterior. There's a large knee joint moment. They're loading into that knee a lot. They're not absorbing much at the hip. So for that, I'm like, okay, am I happy with the knee taking that much load? Do we need to teach them a second strategy that is available for them as a potential solution? Or are they really forward trunk lean, and in that they've moved their center of mass forward, create a large hip moment, a small knee joint moment, and are they knee avoidant? So I'm kind of thinking about, all right, is that because they've got no ankle dorsiflexion range, or just does it fit their pattern, or is it apprehension? So it's just a strategy, and my mind goes to why. Like, do they not trust their quads eccentrically? Do they have no ankle dorsiflexion range? Are they anticipating pain? So this is where, like, to me, everything's not just in the data and the science, just watching someone move and taking a little bit from each. But I will also look at landing forces. So I've found off a 30 centimeter step, my norms, it's more male, I think, sort of runners. But again, strength by numbers has a lot of good norms too. But sometimes we all test in our own way. So sometimes I'll trust the way mine, sometimes I'll use theirs. So around that 320% of body weight, looking for. And so if someone has high peak force, potentially they're using a passive lockout strategy because they're not strong eccentrically. So maybe they don't have that ability to break through the quads. And if we're thinking running, if we go back to the kinetics, we're thinking 3 times or 300% of body weight or 3 times body weight going through that lower limb with each step as we're catching ourselves. So do I have a test that tests 3 times body weight through it and their ability to handle that? And I'll often see people who've done a lot of rehab and haven't developed the ability to absorb, and they're back running. And their strategy is a stiff-legged, straight leg. They're walking on one leg and running and using a pendulum strategy on, say, the left, and then a spring strategy on the right. And it's just because they can't absorb, whether it's strength or the brain doesn't trust that leg. And you'll often see this on a single leg landing. So we've kind of gone through power, shock absorption, and then I'm thinking reactive strength. Okay, how springy are they? So reactive strength is basically just the ability to reverse our falling center of mass. So it comes back to that stiffness, that springiness. How quickly can we go from absorption to propulsion, which has huge ramifications for running. So it'll decrease our vertical oscillation. If we're thinking change in direction, we know that we're going to plant that foot and absorb and then push off concentrically in another direction. We need a short ground contact time to save the knee. The more knee flexion, the more knee loads, the more chance it'll move into hip internal rotation, into that kind of potentially vulnerable position. Also, just for performance, if we don't have reactive strength, then we've hit down, changed direction, and we took time, we sink into the knee, and that person's caught us already. So reactive strength is really, really important. Metric stiffness to be measuring, and the longer the delay. So we've got this eccentric phase, we've got this amortization, which is the pause between the eccentric and concentric, and then we're digging out of there. So the longer the delay here, the more elastic energy is lost as heat. So the Achilles only stores elastic energy for about 0.25 of a second before it's lost as heat under the process of hysteresis. So basically, if we think back to the ground contact time of running, it might be around 0.25 for sort of moderate pace running. So we're thinking our reactive strength test, we're probably wanting people off the plates in around 0.25 seconds. Otherwise, they're not using elastic energy well. Elastic energy use is free. It doesn't require oxygen. So muscular contraction requires the use of oxygen. So basically, if we use elastic energy well, if we have good reactive strength, then we're much more efficient metabolically. So in terms of qualitatively, I'll say minimize time on plate or ground, maximize time in the air, or maximize jump height. So I'll do a step, hands-free, I'll do for this, a step, and then spring. So from a movement quality point of view, I'm trying to see potentially, like, do the heels hit? How much knee flexion do they go into, or hip flexion? And then just eyeballing height. So basically, I'll talk about this in the next slide. But when we look at 2 different movers, so this is staying springy. So it's, if we go back to that stiffness spectrum, so it's minimizing our fall in center of mass. It's quick time between absorption and propulsion. There's less knee flexion, there's less hip flexion. You can see here there's a lot more hip flexion, there's a lot more knee flexion. The center of mass has dropped a longer distance. Knee flexion is time on the ground, and time on the ground is knee flexion. So whether that's running or changing direction or doing a drop jump or a single leg drop jump or hopping, anytime we see a lot of knee flexion, we can tell someone is very likely spent a long time on the ground and is not using elasticity. So it's really important to just look at, even if you didn't have force plate, just look at someone's ability to decelerate quickly and spring back out and get a result. So a result being some height. So qualitatively, increased knee and hip flexion is increased ground contact time. Quantitatively, again, I'll assess, I should have said this, but I'll assess either a double leg or a single leg reactive strength. So I'm just talking about double leg first. So drop jump quantitatively. So we're looking obviously at heights. We're looking at ground contact time, and it's height divided by ground contact time gives us reactive strength index. And to me, I just tell people this is how springy your tendons are. If we look at some of the norms sort of here, so obviously it depends what height we're dropping from. I try and keep it consistent. Like if you're working in pro sport, you might standardize it more, or you might consider leg length potentially. But poor might be around that 0.3 of a second ground contact time. We know that Achilles tendons only store an elastic energy for 0.25, starting to get lost as heat. Excellent is off a plate and still getting a result in like 0.2 seconds or below. And we just have to come back to some of those biomechanical demands. So we know that sprinting, where we have this is obviously like an elite sprinter, but maybe around that 0.1 of a second to apply force into the ground. So if we have no elasticity, like we're going to be spending long periods of time on the ground. Time on the ground is just stationary. So we're thinking about why we're assessing these metrics for these different movement, sports, activities. So ideally, we're getting above that 30-ish centimeters. Again, kind of encourage people to collect their own norms, try and get in the process of, very similar way of testing, develop norms of potentially even similar types of athletes, or utilize, lean into the testing protocol of strength by numbers and use some of those norms as well. But it depends on your cohort or how much you want to just understand a specific population as well. So again, off the ground, quickly with a high height, we're going to be that fast and powerful. If we get good heights, but it takes us time, we might be strong, but not as reactive. If we're on the plate for a long time and we get nowhere, we probably need to work on both. So this is just a general insight into someone's springiness. So we're looking at height, ground contact time, reactive strength. So if we were more specific, we could go, and again, it depends on the skill and the strength of the person, but I'll often choose like the 10 hops in a row or a drop hop. Same type of cues, minimize time on plate, maximize time in the air. And qualitatively, does the heel hit the plate? Does the heel hit? How much knee flexion do they drop? Do they keep the leg straight or pop up a bit? My left is me. My left calf and Achilles is pretty useless. So I probably use a strategy, and that can be over analyzing, but that might give me a bit of a false metric if my knees kind of bent and gone into like a bit of a tuck jump. So sometimes people tuck jump jumps, and that will inflate their flight time and maybe height too. So quantitatively, we're obviously looking at height. We're looking at ground contact time. Gives us a single leg reactive strength index. Really, really good if we're rehabbing someone, especially back from Achilles issues, ACL, like all knee issues, even hip issue, like long term. Have they regathered or regained single leg plyometric ability compared to the other side, but starting to be compared to norms as well? Like the other side may not have great springiness anyway. So if I was to adapt a little bit, I might throw in what's called a rebound hop for single leg reactive strength. So this looks a little bit like this. That wasn't a great
So
pull
well.
on that side. I'll just fast forward to the left. So what I'm looking at here is time on ground or on plate by hop distance. So how springy are they? How quickly can they get off the plate to produce a result horizontally? So I let them pick how far because I think everyone's different. They're going to self-organize a strategy. They'll choose the distance, but I'll say try to spend as little time on the plate and hop as far as you can. So again, I might use this test if I want to assess the hip or the ankle a bit more because a horizontal hop for propulsion is much more ankle and hip dominant. So it's just understanding, okay, I'm assessing reactive strength, single leg, which we know we need. I'm looking at ground contact time side to side. So for me, hop distance divided by ground contact time might give me something I think of as like a horizontal reactive strength. So how springy are they horizontally? So horizontal or vertical. So I talked a little bit about this, but I'll consider the region we're testing. So if I'm thinking of assessing sort of the knee, when we look at a horizontal hop, only 13% of the propulsion for a horizontal hop comes from the knee. So it's actually generally, depending on movement strategy, but it's generally an assessment of hip propulsion, ankle propulsion. So if I was assessing a calf or Achilles, maybe I'd look more at that rebound hop, but I'm just adapting based on person, but also tissues to an extent as well. Okay, so we're getting through it, but just a few more tests. So then I'll think of strength and strength endurance. So isometric strength. So what I'll add in will often be a side lie hip abduction. So we know that that glute med is taking 3 to 4 times body weight. I want to know how capable is it of producing force. For me, I'll often get someone's side lie. I'll lunge and kneel behind the pelvis to stabilize, stop rotation back. I'll get my force behind the dynamometer, and usually I'll go 30-ish degrees of abduction. And again, I think as long as you're consistent, then you can trust your protocol. Like if you can reason, okay, I think that's going to isolate hip abduction for me, then that's what I'd suggest going with rather than always just protocol if it doesn't make sense. But norms for that, around that 20% body weight, female, 22% male. Axis norms, I use them a lot too for that one. But yeah, I'm gaining insight into hip abduction strength, even if it's an Achilles or patellofemoral pain. I'm understanding what I'm testing. For hamstring, isometric strength. So I'll throw in a hamstring 90-90. Even though there's not huge loads going through that hamstring during like steady running, often, we'll see hamstring tendinopathies or for uphill running that changes or for sprinting. So obviously a big muscle group that will commonly see injured. So it's, to me, still important to have that, even if the demands are lower for the activity I'm looking at. That position's probably not perfect, but to me, it has some relevance towards that late swing phase where the hamstrings, it is working eccentrically, which, I just don't have other equipment to test that eccentric as much. But I'm looking there at peak force. So you could look at rate of force development. Again, I simplify it. I've just chosen to look at that because I'm looking at rate of force development more globally on things like hopping. Seated knee extension. So Andrew told me this is the most common test done, and I actually don't do it that much. I was trying to reason myself why, and I think to me it just came down to I got quite good insight on someone's single leg landing, and I was probably a bit more interested in eccentric quads rather than purely concentric, but I will use it definitely from time to time. But also, like, it's been a bit harder for me to set up. So I don't have as many norms, but I'd trust into some of Accets for that. But understanding that we're getting that isometric strength of the quads. So last one for isometric strength is seated soleus. So we know the huge loads going through that soleus, so that's 6 to 8 times body weight. Set up here may not be perfect, but it's a tricky one to set up. But yeah, going to be a really important muscle group to understand someone's lower limb function as well. So rounding out the assessment, so we've gone through that movement quality, range of motion, power, landing, springiness, strength, and then lastly is just strength endurance. So I'm looking in at someone's single leg calf strength endurance to fatigue. Again, you're looking at that consistency and testing procedure. And I'll just lean into some of the norms from Kim Hebert-Lozier for this one, just because that was a huge sample size. So that looks at different age groups, males and females. And I'm looking at that here, that calf capacity. And if we've collected that, we've got a pretty good overall profile of plantar flexor muscle tendon function. So we understand power, reactive strength, that strength of soleus, and then strength endurance of the calf complex. So we have a pretty good profile of calf function. And last one is occasionally, if I don't do the isometric, I'll just do like an 8RM on a single leg knee extension. So just loading the plate, seeing if they can get 8 reps out, go up a plate and go to that fatigue point and just record the reps they got to at that weight, and then in comparison to the other side, and then slowly into comparison to some norms. So to me, I'm thinking strength endurance a little bit more for the quads, just because of that, again, that fatigue ability. So I think when our quad fatigues, our biomechanics fall away. And it's just that little bit more relevant to me than isometric concentric strength, but that's just my preference. Okay, so that is the testing process. That's the systematic way I'll go through, and I'm always changing it, and I'm not always doing that whole thing as well. It's just a framework of how I think through these different physical qualities as opposed to randomized tests. But one question I have had is like, does order matter? So should you do certain tests first? And for me, I order it in the way I would write a program. So in strength and conditioning, often it's, again, if someone is capable with their injury, but often you do plyometrics and power early because you need that intense, you need that reactive strength. You don't want to be too fatigued. So I'm sort of assessing those, and then I'm writing that as my program. So it starts with plyo. It has headings for each one, which I'll go through in the second lecture, how this informs how I'll write a rehab program around those attributes: plyo, power, absorption, main strength, isolated strength, hip and core control. And again, depends on your environment, depends on the flow of, testing, depends on, if there's pain, and you're always going to adapt with injury. So the last step would be, how can I compare scores to healthy athletes? So this is where developing norms around your testing protocol, using some assets. How can we compare not just to the other side, but what's normal, what's healthy? How do we know when they're back to norms if the other side's deconditioned anyway? So I'll still in the process, but often I'll create a bit of a lower limb profile around sort of power, range, strength, endurance, and some of the running metrics, and then just present that on a graph as well. This is not all the time, but if I was being really thorough, and that just gives me a bit of direction then for rehab. And essentially all I'm looking for is, what do I need to reassess to know that my program is working? But also, if this is a long-term chronic injury, like, where are their individual weaknesses? Like, obviously other potential approaches haven't worked. We need to kind of find out how to rebuild this whole person's lower limb. And then I need to implement a program based on those attributes, and then know how and what to reassess. So I'm programming for qualities over exercises as well. It just gives me structure for the programming too. Um, yeah, so if anyone has, I've got lots of references for that presentation, but I won't list them all out. So if you have any questions, yeah, feel free to email or want certain reference, just send me an email as well. But yeah, that's pretty much my summary, and it seems like a lot, but it's not always that extensive. It's just a systems thinking approach to assessing function.
Great. Thank you, Tom.
Thanks.
What a great presentation. I hope, I hope everyone who has watched that is feeling a little bit more comfortable with, that systemized approach, which I think is just so important. We've had a few questions actually come through, just on the email, actually. So I might, just throw those to you, Tom, if you've still got just a little bit of time.
Yeah, go for it.
One of the attendees asked, where do you see clinicians or practitioners overcomplicating their assessments when, maybe looking at some of this stuff? Have you got any thoughts or opinion on that?
Um, yeah, I think that like some of it comes back to probably leaning too much into the data when they should be looking at movement quality. So yeah, I think it's just like marrying up coordination with like the metrics that you're finding quantitatively as well. And also like, yeah, not getting too lost into over analyzing one specific test um, or testing findings. Yeah, I think the role to me of coordination is really, really important, that we can like trust some of the results, but you have to have an understanding of the way, the how someone executed that movement.
Absolutely. And that probably then leads into the next one. One of our attendees said, is there like a common mistake or something that you see when people are trying to use the technology side of things, like specifically, I guess, focusing on the technology? Is there something that, you really feel is, I don't know, maybe a common misdemeanor or something in that respect?
Um, Probably the same thing, like not looking at movement strategy. Um, Common mistake. That's a really good question, actually. Just not having a system, I think. Just pulling random tests out. But maybe also not knowing what they're looking for on a test. So, like, you do get a lot of metrics there, and it's confusing. So, just what I've done is like, as I said with the hamstring test, like I could look at more metrics, but I'm just like, no, like it's an overload of info. Just choose something relatively important. And if you miss a little bit, that's all right. Like you probably picked it up elsewhere. So, like, don't be afraid to miss some stuff if you're still getting like 80% of the information.
Hmm. Uh, One more question that we had was, with this type of approach that you have, how often would you retest this? Like, I mean, you're doing these type of assessments that you've outlined today. When are you following this up in a lot of the people that you work with?
Yeah. So what I'll do is like this just informs a program. So like if I test someone and I think that yeah, I found some foundings, then I'm just going to implement a 4 week rehab program or strength program. And like that will usually be based around like either just like motor learning, hypertrophy, strength, power, reactive strength. And that'll go for 4 weeks. So like I might see them in that time. If it's someone from afar, I might not, but I'll assess that after 4 weeks. Usually like the asterisk sign. I'm probably not going to do the whole thing again, but like you need structure and your program to then have that reassessment. But in terms of like the whole reassessment, like I might just assess a few things, but if I was to implement a strength and conditioning program, that almost needs to go for 12 weeks. So if I had like an uninjured runner, I'd say come in 12 weeks before, or like 13, 14 weeks before a big event, implement a 4 week a testing 4 week block, another 4 week block, another 4 week block, and you might sort of test at the end to see if it's improved. So it's either like your 4 weekly or like after your overall like 12 weekly program, but you need structure around your strength rehab program to know when to reassess.
Which is probably actually the best possible segue that we could have, due to this webinar series that we're putting on around, systematic approaches, obviously, to assessment, which we've covered today. And then we'll be following that up again in 4 weeks' time on Tuesday, the 28th of April, at the same time, for a systematic approach to exercise prescription and, looking at kind of what to do and implement off the back of this. So yeah, brilliant segue there, Tom. I'm really looking forward to that one as well, because I think, in a similar manner, I think we can probably overcomplicate our assessment in many ways, and having a systemized approach can help make it a lot more comfortable, a lot easier to digest, a lot easier for us to get valuable information from that. And in the same manner, there are probably systematic ways in which we can then implement interventions off the back of some of this to really, I guess, affect it in a positive manner. And yeah, I'm really looking forward to what you've got in store for us in 4 weeks and on the 28th of April.
Yeah, awesome. Yeah, I think it just leads straight into it. Basically, I wouldn't assess anything if it wasn't going to inform a program. So um,
That's
you can't really have one without the other. So
that's exactly right.
that'll be
They're
good.
very, very related. Well, look, as we kind of said, we'll obviously be sending out the recording of today's presentation. That'll also include the details on how you can register for that follow-up event in 4 weeks' time. There'll probably also be a survey or something like that in there. So please take the time to fill out that. But for anyone who wants to catch up or see any of the other content that you produce, because I know you're big on social media. Where do they find you? What's the Instagram handle where they can follow you and kind
Yeah,
of learn more?
yeah, I should have had that in there actually. Yeah, so most of my education's through social, yeah, through Instagram. So it's mechanics underscore of movement. Um, so yeah, you'll find a lot of this stuff just kind of slowly littered throughout that over a few hundred different posts. But it's just been a process of developing my own reasoning over time as well. Yeah, so through this.
Definitely worth a follow. We're definitely worth checking out. There's lots of gold, lots of gems there. I often find myself learning a thing or two. So yeah, make sure you check that out, everyone who's watching today's presentation. And yeah, we'll leave that there for today. Thanks again for joining us. And of course, yeah, we look forward to seeing you again at the next one in 4 weeks' time.
Thanks, yeah, thanks everyone.